Hello, this video is entitled Pinched Nerves. Pinched nerves occur in the neck, in the mid-back, and the lower back. Very often when they occur in the neck, it can cause various symptoms: pain, tingling, numbness, cold sensation, hot sensation, burning sensation, into the shoulders and down the arms, even into the fingers. When they occur in the mid-back area, it can cause pain traversing the course of the ribs and coming around to the front, where it almost feels like a heart attack. It can cause shortness of breath because of the spasm of the intercostal muscles, which are the muscles that control the ribs, that spread them apart and bring them closer together when you are inhaling and exhaling. Irritated nerves or pinched nerves can occur in the lower back. When they occur in the lower back, it can cause pain, tingling, numbness, and cold sensation, hot sensation down into the buttock and into the legs, all the way down into the toes, tingling, numbness in the feet. So it can mimic other diseases such as diabetic neuropathy, peripheral neuropathy, and it's kind of confusing because we need to figure out exactly where the nerves are being irritated and then why they're being irritated. So they could be irritated in the back, they could be irritated in the knee, just lateral or to the side of the knee, and also in the foot itself or in the ankle that causes symptoms into the foot. So the location of the pinched nerve is really critical as far as treatment is concerned. We need to know where the nerve is irritated and why the nerve is irritated. Picture the spine, because the most common irritated nerves or pinched nerves are in the spine. So picture the spine as a series of donuts, one sitting on top of each other, and the whole represents the spinal canal where the spinal cord travels through that canal. So what can happen is you can get the most common form of pinched nerve, which are the spinal nerves. When these bones move out of place, as I'm showing you here, and they narrow the size of the hole where the nerve exits from, which is called the interforamen. And when they irritate that nerve, wherever that nerve goes to can cause symptoms. If it's going to the muscles, if it's going to the ligaments, if it's going to your skin, if it's going to your organs, it can cause problems or malfunction in these particular areas. So that's the most common form of pinched nerve. The second is in the spine itself, in the spinal canal where the spinal cord is. You can get a herniated disc where the disc moves backwards and presses on the spinal cord or the spinal nerves. You can also get a narrowing of that spinal canal as a result of osteoarthritis, where there's degeneration and calcium and bone formation, and that can take up space in the spinal canal and compress the spinal nerves or the spinal cord. So that would be called spinal stenosis. A cyst in the spinal canal, a tumor in the spinal canal doesn't necessarily have to be cancerous. It could be benign, but they can also put pressure on the neural structures as well. As far as treatment is concerned, it really, again, depends on the cause of the problem. If it's a carpal tunnel syndrome where the nerve is being compressed in the wrist or pinched in the wrist, then we have infrared and laser treatments for that. If it happens in the spine and it's as a result of a herniated disc or a protruding disc, then we have a Cox distraction and vertebral axial decompression, or VAXD for short. If it happens in the neck, we have Cox distraction for that. If it's a diabetic neuropathy, then usually laser treatments, including infrared, will take care of that. So that's pretty much it as far as pinched nerves are concerned, and I hope you found this informative. And if you feel the need to call us, it's 941-365-6400, and you could ask us any questions that you have regarding pinched nerves if you feel that you have pinched nerves. Thank you, and see you on the next video.